Okay, donc this session was indeed a summary or presentation of several studies performed on sequential therapy. As you may know, sequential therapy has been emerging these last 10 years and gave very good results in terms of eradication of Helicobacter pylori. And in most cases, if any, better than the standard triple therapy. The problem that many studies didn't include any susceptibility data. But the few which included such data showed that sequential treatment could be effective on resistance strains. It's probably because giving amoxicillin as the first antibiotic alone would decrease tremendously the load of bacteria in the stomach and so eliminate all the mutants which are resistant to clarithromycin. So there was the study by Dr. Gatta from Bologna, who presented such data with clarithromycin resistance and proving that it was better in this respect. There was also another study showing that if you increase the amount of amoxicillin that you give at the beginning especially, you also improve your eradication rate. There was also attempts to show that you can possibly give the drugs not sequentially but concomitantly. And there was a study from Naples, South Italy, which showed that the concomitant therapy had as good result as a sequential, and even you could replace clarithromycin by levofloxacin, which is a fluoroquinolone, usually quite efficacious on Helicobacter pylori. In addition, there was a meta-analysis done on all the trials performed in this respect, highlighting that the sequential was better, but there was some doubt because most of the studies were coming from Italy, and so they asked it should be better if we could have more data outside of this country. By the way, the last talk concerned a study from Puerto Rico, and very surprisingly this sequential therapy was not so efficient. I must say that I don't understand the reason. It's possibly a problem of compliance, it's possibly a problem of metronidazole resistance, but there was no data, only historical data, which were not able to confirm, to explain this result. So it was an interesting session globally on this sequential treatment. I think it is one of the treatment of choice, but it's not the only one, because you have also the bismuth-based quadruple therapy, which is now sold and also give quite good result.